NCOC started back in 2008. So NCOC stands for North County Outreach Collaborative. It's 5 agencies. So it's Asian American Recovery Services, Pacifica Collaborative, Daly City Youth Health Center, and Daly City Partnership. And originally, Pyramid Alternatives. Pyramid Alternatives have since merged with Star Vista. Asian American Recovery Services was founded back in 1985 in San Francisco to address the needs of Asian American Pacific Islanders um, substance use issues because they were not attending, your mainstream services. So that's back in 1985. So we started off with a treatment program in San Francisco. In San Mateo County, we came here in 1998. So our mission really is to provide services, culturally responsive services to the API community that wouldn't otherwise seek out services.
We are a federally qualified health center that has a combination of primary healthcare services, health education within high schools. We also do substance use prevention, and one of our biggest programs is our behavioral health services. And we provide care across 3 different school districts, which are Jefferson Union High School District, Jefferson Elementary School District, and Pacifica School District, as well as throughout the community and within our clinic located in Daly City.
Our program, Community Outreach and Volunteer Engagement, is a Department of Daly City Partnership with the mission to connect individuals to programs designed for social, cultural, and economic change. We connect families to everyday necessities like food and clothing, and we also oversee our thriving volunteer network that makes all the work that we do possible. In the partnership, we offer a wide array of services for families and individuals. We have a department for after-school enrichment programs. We also have another department that focuses on aging adults and people living with disabilities.
So the Kapo Cultural Center and Cafe was pretty much birthed out of the Filipino Mental Health Initiative. And so FMHI was able to identify funding through the state. So Mental Health Services Act funding under the innovation category. And so what the Cultural Center is, which is actually a department of the Daly City Partnership, that holistically we're providing resources to address, basic needs like housing, financial wellness, mental health and wellness.
What's really beautiful about the collaborative efforts with NCOC and our North County organizations in general is how we've built really lasting, trusting relationships with one another, how there is not a sense of scarcity, rather a sense of community. And if we establish a good community, a powerful community amongst ourselves, we're so much better positioned to fortify the communities that we serve.
None of us have services that covers all the needs of our communities. And I think that's where our strength comes in. With as 5 agencies, we have different expertise, that we have different cultural backgrounds that we're able to kind of target and reach.
Not only do I serve locally as a local elected official, but I'm also a professor in ethnic studies at Skyline College, and I also run a nonprofit that teaches undergraduate students and graduate students to become ethnic studies educators. And these students are also part of different organizations that allow them to address issues such as mental health. The Mayor's Mental Health Initiative that I was a part of was to break away from this kind of like barrier of saying like, our mental health is important and it's not something that we should just swallow and hopefully goes away. That the true way of attacking or addressing these issues is to be in community and to find ways where we can have people that are trained to see what first response can be in terms of mental health.
It's amazing how all the services in the community have been woven together and interlaced to provide as much as possible everything that an individual or a family needs. For the food program, that program started very small with just 50 families every month. And now, 3 years into the pandemic, we are now serving 1,500 families weekly, now open from Monday to Thursday. And the application to be part of the program, the enrollment process, happens every day. The growth of the program is just outstanding. That just signifies the need in our community.
We've definitely seen the level of need rise dramatically, compounded with the pandemic. We've had a pretty high need in the Daly City area and North San Mateo County in general, I'd say, because this is the area with the most diverse population, as well as the highest immigrant population, the highest population living in poverty out of San Mateo County. And when you combine already existing significant needs with something as big and impactful as the pandemic, what we've seen is a drastic increase in need for mental health services, for physical health, for housing and food security, and just an all around need for support.
Through my lens as a city official, as a part of a nonprofit organization, as a person working with KKC and DCP, is that youth are hurting, youth are crying, youth are cutting, and we have to find ways in our community to address this issue.
I first stepped foot at the community center as a client not so long ago, and I could honestly say that I see myself in every face that we serve. I see myself in a family waiting in line to receive food. I see myself in the parents who are trying to set an appointment to shop for free at Pat's Closet or receive backpacks for the school year. In many ways, I see myself in people who are moving in Daly City for the first time to replant their roots. So all these circumstances that position me where I am, I hold very dearly in my heart because it gives me true understanding of what the community that I'm serving is really experiencing.
In partnership together with NCOC, we frequently will hold focus groups and ask the community what their needs are. We will travel to the community, right? Because everyone's working with a different set of circumstances. And, as an example, we might have a single mom of 5 who can't come with all of her kids to our center to receive care. And so what do? We will come to her home. And not only that, but we will stop by Daly City Partnership and pick up a box of food and bring it to her, right? So we will do whatever is necessary to support our clients and to connect them with services.
Because of this community care and community collaboration, this type of care and this type of service provides an investment for young people to extend beyond themselves and to challenge the false mythologies of everything is done by myself, that I could do this only by myself. Like everything's an individual thing, when to me, I think that's a falsehood. Like everything is done in collaboration. And knowing that this is a vocation that is lifelong journey towards community action, social justice, equity, freedom.
NCOC was one of our first programs that allowed us to specifically target Pacific Islanders or Native Hawaiians, right? And then from that, we developed Journey to Empowerment through a community member, where they wanted a space for the community to convene and create a safe space to talk about taboo topics, right? Such as mental health, substance use disorders, child abuse, domestic violence. And from there, Nani Wilson was asked to, who was Pacific Islander, was asked to do a parent workshop through the Office of Diversity and Equity. And specifically working with Pacific Islander caregivers, parents and caregivers.
Ours, for instance, offers a really wonderful parent class, and we can send our parents to them, and they can send their mamas to our mom support group, right? And if at any point somebody needs food assistance, we send them down to Daly City Partnership. So there's this real ability within our community to wrap the people for in whatever way that they need, because we collaborate well together.
And I think what we're trying to do is create this idea of intergenerational healing that can combat intergenerational trauma. What it allows me to do as an elected official is to see what, have an empathetic view in terms of like what they're going through and what they voice as issues that are affecting them, and being that one person, that one vote in the boardroom that can represent that voice. And the way that I am able to curtail this picture and create this whole picture is the different partnerships that I have with these students, with the community-based organizations like Kapu Cultural Center, working with Filipino Mental Health Initiative, and all these different community-based and student-ran organizations that it allows me to understand what experiences they're going through. And because they're very similar to what I've gone through growing up here in America as well. So it allows me to address the issues that they're going through and have this purview of what's going on in the city and really voicing out these issues that they're going through.
The Kapwa Cultural Center and Cafe, also known as KKC, is intended to really take a look at the systems of oppression and how they have caused harm on our communities. And so what that means is, like, we want to ensure that we are engaging community on all different levels. It's not just through our elected officials and, and through our school districts, but, looking at grassroots initiatives and other CBOs that are doing this amazing work. So some prime examples of that are, for instance, through May, we have what's called the AANHPI proclamation that was birthed in 2018. And since then, we were able to collaborate with different initiatives like the Chinese Health Initiative, the Pacific Islander Initiative, and other community members in solidarity to ensure that resources, specifically financial resources, are funneled through the county to our communities in need. And, we are pushing health equity on all levels, and wanted to name that we are also engaging local businesses and entrepreneurs who are learning about the inequities and can be also ambassadors.
That's the foundation of everything that we do, is collaborating for us to be able to access diverse perspective and hearing how other people from different backgrounds, cultures, and fields take on this big problem that we're all experiencing.
And that includes collaborating with organizations that are roots on the ground, that are embedded within the community. That includes having staff that represent the community that we serve, having staff that speak the languages of the communities that we serve,